Hello, everyone. So, for my risk analysis project, I chose the risk of not seeing a healthcare provider. The reason I chose this plan is because I have a little bit of a part of that, and I'll tell you about that as we go on. So, here's the introduction, the table of contents. So, we'll do the purpose of the risk analysis management plan, process, risk identification, risk analysis, the risk response profile, my SWOT analysis. We'll go over the qualitative risk analysis, the risk management planning, my risk map, and then some references and definitions. So, introduction, the purpose of the risk management plan. The purpose of this risk management plan is to identify, assess, and mitigate potential health risk associated with the decision not to see a healthcare provider for routine checkups, preventive care, or treatment of emerging systems. This plan is designed to help individuals evaluate the consequences of delayed or absent medical care, understand the potential impact on their health and finances, and implement strategies to minimize harm. So, the risk management procedure, the process, this plan will follow a structured risk management cycle. We'll have risk identification, risk analysis, risk management, self evaluation, a SWOT analysis, and a risk map. And the risk identification, first, for not seeing a healthcare provider may lead to delayed diagnosis of chronic illness, undetected serious conditions, mismanagement of minor conditions, higher long-term costs due to complications, a decline in mental health without professional support. So, risk analysis. First, you evaluate each identified risk by estimating the likelihood, low, medium, high, and impact, low, medium, high. And then I'll place those on a risk map for prioritized focus areas. So, the risk management, what risks are there for not seeing a healthcare provider? So, it's the hazards, there's health deterioration, delayed diagnosis, personal safety. Operational risks, self diagnosis errors, lack of preventive care, and limited access to medical records or professional guidance for ongoing conditions. The financial risk involved are higher long term medical costs, loss of income due to serious illness may prevent work or daily activities, and then insurance issues. Some health plans penalize lack of preventative visits or require proof of annual checkups. So, some strategic risk are reduced quality of life, as in chronic pain, fatigue, or untreated conditions can impact productivity and well-being, missed long-term health goals, and reputation or dependability risk. Declining health can affect reliability in personal or professional roles. So, how do you measure the risk? What is the chance of the risk occurring? How bad will it be? Measure it on a level of low, medium, or high. So, my hazard risk I put is high. If I do not see a healthcare provider, there's a good chance I will miss a potential health risk. Operational risks are medium. Even if I don't see a healthcare provider, I could use outside help that could help me make a diagnosis. The financial risks are high because if I don't see a healthcare provider, when I do get sick, it could cost more because it could take longer to treat the illness. I could also miss days at work if the illness is serious. And then on the strategic side, strategic risks are high, but not seeing a healthcare provider, by not seeing a healthcare provider, I risk having a long-term pain, not being able to prevent disease, and risk of declining health. So, to examine the solutions, how did you deal with the risks? Accepting the risk, accepting the minor risks such as skipping a non-urgent visit when symptoms are mild. Recognize that not every health concern requires immediate care. Avoiding the risk, choose to schedule wellness exams and avoided risky behaviors such as ignoring persistent symptoms. And then controlling the risk. Use preventative self care such as a balanced diet, regular exercise, good sleep, and stress management. Could also use home devices to check blood pressure and sugars, and then use telehealth for minor issues. And then transferring the risk, maintain health insurance to offset unexpected medical costs. Utilize flex spending accounts to prepare for health expenses. So implement solutions. So I decided to see a healthcare provider. What was your process? How did you implement the solution to avoid minimizing the risk? So after evaluating all risks, I implemented a plan to minimize the negative impact of not seeing a healthcare provider. So the reason why I chose this topic. So I'm a male breast cancer survivor. I had a lump in my breast for several years, but being a male, I just thought it was a cyst, didn't worry about it. Then one day, the lump became very hard and misshapen. I told my wife about it, and she immediately made me a doctor's appointment. Then, after going through all the testing, the mammogram, and a biopsy, it was determined that I had breast cancer. I ended up having a surgery and 18 lymph nodes removed, and also 33 rounds of radiation. Had I been more proactive about my health and gotten the lump checked out early, I might have avoided surgery and only needed radiation. Because of this situation, I have tried to be more proactive about my health and will see a doctor if I am unsure about something. So, my SWOT analysis. So, the strengths of not seeing a healthcare provider is it saves time and money in the short term, avoids unnecessary visits if generally healthy, and encourages self awareness and self care. Weaknesses are increased risk of undetected illnesses, lack of professional monitoring of chronic or emerging conditions, limited medical knowledge may lead to misinterpretation of symptoms. Opportunities are utilizing technology like apps and telehealth, improve personal health literacy to manage minor issues independently, and then seek community health screenings or low cost clinics. Some threats of not going to a health provider is severe complications or preventable illnesses could develop unnoticed, higher long-term healthcare costs due to delayed diagnosis or treatments, and mental health issues may be overlooked or untreated. These first two here are something that I went through. I had the cancer and then the cost of having to go through the surgery and all of that. So then we get into the quantitative risk analysis. The probability impact of occurrence for each identified risk will be assessed by the project manager, which is me, with input from the project team, which is also me, using the following approach. So have this chart with the high, medium, and low. The impact will be on here with probability, quantitative list, risk analysis, sorry, and then the risk response planning. So down here, things to avoid, how to mitigate, accept, and transfer. So here's my risk map. So the risk that I had on here is delayed diagnosis of chronic illness. So the likelihood of not seeing a healthcare professional and the impact are both high on the list. So they're up here in the corner. Undetected serious conditions, likelihood would be medium, but the impact is high. So that's over here. And then mismanagement of minor conditions and also decline in mental health without professional support were both medium. So that's right here in the middle of the chart. And then the higher long-term costs due to complications are both also very high up here in the corner. So as you see, I am the risk manager, so I have signed my name on here. And here's a couple of websites that I use, one from Health Network about men's health, and then Very Well Health, 4 reasons people don't go to the doctor. And both those were located on the internet. Then some definitions I have here: risk management plan, a structured approach to identifying, assessing, and responding to potential risks that could affect objectives or outcomes. Risk is the chance of something happening that will have an impact on objectives. Risk assessment, the overall process of risk identification, risk analysis, and risk evaluation. Risk monitoring, regularly checking in on identified risk and the effectiveness of response plans. Risk management, the culture, process, and structures that are directed towards realizing potential opportunities while managing adverse effects. And then preventative care, regular healthcare checkups and screenings that help detect, prevent illness early, and reducing the risk of severe outcomes. So, like I said earlier, this is a really close subject to me. I had that lump for several years, didn't think anything of it. And when I finally went and got it checked out, it was cancer. And because of that, I had to go through a lot of the motions, the surgery, having the lymph nodes taken out, and then also having radiation. So it's something that I have a scar. Had I done something earlier and been proactive about it, maybe there would have, I caught it sooner. I could have just had radiation, and it would have gone away and not had to worry about surgery or anything like that. So if there's one thing I will say is, if you have any issues about your health or are worried about your health, you should go and see a doctor and find out what's going on, because in the end, it will be better. It would be better for you, better on your finances, and better overall. So I hope you guys liked my presentation. Thank you very much.